Hello to all the viewers. So, with me, I have today Dr. Vedant Nilesh Kumar, who has got a rank of 7 in the AIMS merit list, INISS DM Neurology, and rank 16 in the common merit list. So, welcome, heartiest congratulations. So, how are you feeling
Thank
now?
you, sir. Sir, feeling great, sir. It's a great feeling,
After the
sir. And sir.
exams were postponed, so much of
Yes,
twists
sir.
and turns with the patterns, uncertainties,
Yes, sir.
and COVID hovering around, it
Yes,
was
sir.
a really tough year for everyone. So finally, you
Yes,
are
sir.
relieved. You'll be able to join a central institute. I'm sure family,
Yes, sir.
everyone must be happy.
Yes, sir. Definitely.
And I
We are all
suppose
very
you
happy.
are engaged also. So, you would be
Yes,
also
sir.
be extremely happy. Okay. So that is a wonderful.
Yes, sir.
All right.
Yes, sir.
So, Vedant, basically through this interview, let us try to give the INISS aspirants a direction on how to prepare for a central institute. So, before we begin, please introduce yourself, from which college you did your MBBS
Yes,
and
sir.
MD, a bit about yourself.
Yes, sir. Hello, I am Dr. Vedang Desai. I finished my MBBS from Government Medical College, Surat, batch of 2011. Following that, I gave my NEET PG and I qualified for my MD Medicine at NHL Municipal Medical College, Ahmedabad. I graduated from MD during this year only, July 2021. Because of COVID, of course, the exams were postponed a bit, but finally we did pass our examinations. And sir, after that, like I had decided to pursue DM neurology from my first year of MD itself. I wanted to pursue neurology itself, and so I started preparing for it straight away as soon as the exams ended. And like we were not sure about INI becoming the pattern this year. We were
Yeah.
still under the impression that we might have to give different institution exams this year as well. So, sir, that way I had started gradually
Yeah.
preparing for neurology, sir.
So this is the country's first INISS exam,
Yes, sir.
and to get a rank of 7 in the
Yes,
AIMS merit list 16 is a big, big achievement, because it is an exam which is of immense pride. Okay, which is not a
yes, sir.
single institute; it's multiple institute combined. So the level of competition is also high. All right. So first of all, to begin with, Vedant, can you just go through the exam pattern and the level of questions in the
Yes, sir.
INISS, because this is the first exam, and definitely aspirants preparing for the upcoming INISS would want to know what is the pattern of questions being asked in INISS. Your take on it.
Uh, Sir, the distribution this time, though we were not certain about the perfect distribution, sir, it was more of 50% of the subject that we are choosing, the super specialty subject that we are choosing, 50 out of 80 questions, and 30 questions of the broad specialty, that is general medicine. So, sir, that was the pattern that was there. Apart from that, sir, the core questions, that the majority of the questions were very clinical based, sir. Less
Okay.
of factual, more of clinical based, with sir, lots of images, also lots of case scenarios, and sir, that constituted the major chunk of the questions. A
Okay.
few questions regarding trials, a few questions regarding the scoring systems, and sir, a few factual based questions, sir.
Okay. Yeah. So you're saying the
Yes, sir.
neurology segment was
And
mainly clinical one. Yeah. Please go on.
yes, sir. And sir, apart from that, the general medicine section, sir, a lot of questions came from critical care, sir.
Okay.
Critical care in general. And sir, very few questions here and there from minor systems, such as maybe rheumatology or sir, let's say respiratory system. The core branches are that is nephrology and GI. They had an equal number of questions. And sir, also being it INI being a AIMS kind of an exam, sir, they also had a few questions about poisoning, sir.
Okay.
So, sir, AIMS sticking to its roots of questions, sir,
All right.
they also asked about
Okay.
poisoning, sir.
So from this, from your initial outline of the question paper that you gave, just let us take, for example, the neurology question paper. How would you rate the level of toughness of the question paper? Easy, moderate, difficult? How would you rate the toughness?
Sir, somewhere between moderate and difficult, I won't say very difficult, sir, because a few of the questions were quite easy, sir. A few of the questions were quite easy to begin with. So maybe I can say 20 to 30 questions, everyone must have got them right. All those who were aspiring for DM neurology might have got it right, because they were base questions or core questions from Harrison itself. Like they were straight away given in Harrison tables, flowcharts or diagrams, sir.
Okay. All right.
Yes, sir.
Okay. So then, comes a question which every aspirant asks. See, if someone is preparing for INISS DM neurology, is Harrison alone enough? Or, did you have a read through Bradley as well?
Sir, as far as INI exam, the current exam that we gave goes, sir, Harrison alone may not be sufficient, sir. Just Harrison is not sufficient. But one thing is for sure, sir, if you wish to score, then whatever is there in Harrison has to be at the tip of the tongue.
Correct.
It's best to get whatever questions are coming from Harrison perfectly all right. At least 90 to 95% we should be getting them right. Okay. Because sir, they were right there in the tables, right there in the flowcharts, right there in the diagrams as well, sir. Yeah. So I believe that at least those questions, we can get them right if we are thorough with Harrison. Yeah. Apart from that, sir, some questions from epileptic encephalopathies, a few recent updates, sir. Maybe, sir, the 8th edition of Bradley can help in those questions, sir. So generally, when we study for MD, our core focus stays in Harrison part 2, sir. Yeah. We try to negate a bit of part 1, sir, but that is equally important, sir. A lot of questions
from neuro-ophthalmology.
Yes, sir. Definitely.
Candidates actually neglect that part as well. All right. So, you give a very important message there. You should not neglect the part 1 of Harrison as well.
Part 1.
All right. And so what he's trying to say is, see, Harrison is very important. You have got to strike everything that is going to come from Harrison. Plus from Bradley, well, it's not a cover-to-cover reading that is required for Bradley. But what you can do is that go through those important tables. Actually, all those important tables have been discussed in my video lectures as well. So, everything is there in the video lectures, whatever important tables are there, whatever is likely to be asked, that is there in the lectures itself. So, I think, those important tables would actually do. Now, Vedang, coming to your journey with DocTutorials. So, you have gone through, I think, the entire lectures, the question bank, the test series. So, how did the lectures actually help you?
Sir, lectures for that matter, actually, sir, there are, when we are studying Harrison word by word, sir, actually, we tend to get lost in the entire literature. We don't even realize that, okay, this could be a potential MCQ. So, we actually don't know what is high yield and what is not high yield, like something that we are supposed to remember. Sir, in your lectures, I found one thing very useful, that you always mentioned that this particular section is actually important and this you cannot miss out. So, sir, those high yield topics I used to note down in my textbook as well as the notes I used to make, sir. So, sir, that helped me a lot to focus on subjects where it is very important to.
And even, like I have mentioned also, like especially Central Institute exams, there are certain topic areas like congenital myasthenic syndrome. I've mentioned that also, like even in our WhatsApp groups also I've mentioned, see, this is something that is likely to come up for Central Institutes. And every time they ask, even this time also, they had questions, from the episodic apnea clinical presentation. So, that is about the lectures part. So you have attended most of the lectures. Now coming to the exam series. So about MCQs, because see, you would also agree that it's not just about watching the lectures, you have got to have enough practice. Definitely. So first of all, in DocTutorials about the MCQ practice, we have two schemes of this. There is a structured exam series that is going on, which is a topic-wise exam series that is going on. And we have conducted multiple rounds of such exams also, like under the banner of Elite Exam Series. And then, you have the QBank also. Let's first come to the Elite Exam Series. So, how did you find the Elite Exam Series useful in your preparation?
Sir, definitely useful. Like you said, sir, some topics that are very important for the Central Institute, sir. Sir, so the few questions which I thought that, okay, I have got no idea of. Sir, to start with, of course, no one is all knowledgeable. So, sir, I used to get lots of MCQs wrong. To begin with, my scores were never good, sir. But gradually, I realized that, okay, these topics are some topics that have been repeatedly asked in the question bank in the elite series. And these are the topics I need to focus on to brush up on things where I'm weak. Only then will I be able to improve my scores. So, sir, it was a very good reality check as to where we stand, things that we know well. So they might need one reading, but things that we don't know, they require repeated readings. And sir, one thing I personally believe is just go through MCQs. Even if they are wrong, it doesn't matter. You can get 20-30% marks when you begin with, but gradually they'll keep improving, they'll keep coming. And even the explanation, it gets registered in the back of our mind, and when it actually counts, the recall will happen.
Yeah, actually, even I had an interview last day with AIIMS merit list rank 1 Pushkar also. He was also mentioning the same, that see, he went through Elite and he used Elite exam series as a revision tool also. Like there were lots of questions in the exam series. So towards the end, actually, we had conducted, for example, seizures and epilepsy. At least I think around 3 times we had conducted exams for that seizures and epilepsy with different sets of questions. So he also told me the same, that he would revise these questions and go through the questions, go through the explanations. He might just get an extra point. So that is how, the Elite exam series. Now, how about your performances in the Elite exam series? What about your, how were your ranks in the Elite exam series?
Sir, to begin with, they were miserable. They were actually miserable. Sir, as a fresh pass out from MD, I didn't have a whole knowledge of how to approach MCQ, sir. Attempting MCQs is a completely different ball game, which you improve upon with repetition, sir. So to begin with, they were not at all good. But then, sir, I started attempting more and more MCQs. And sir, with time, I felt that I also started developing a particular instinct about the question. That, okay, I feel that I have narrowed it up to 2 differentials. Now I believe that this question is right. So, sir, with time, I felt that my hard guess also kept getting better. More questions that were 50-50 kept getting right. And sir, the scores gradually improved. And then, sir, by October, sir, I had gotten into the top 20, sir. The final rank list, sir.
So, were you able to maintain consistently the top 20? Yeah. So,
sir, from October, I was able to, sir. Not before that, sir.
All right. Okay. And, you said from October you came to the top 20, and we had done an INISS mock exam as well. So what was your rank in the mock exam?
Sir, it was rank 16.
16. And your actual exam rank also was common merit list 60. So I think, there was a good reflection. I still remember for that exam,
definitely, sir.
Pushkar was rank 1, and even for the AIIMS merit list, he's rank 1. And even many candidates in top 10. I think, but these top 20 candidates of the Elite exam series remained almost like that. So there was a lot of students participating. So did you get that competitive spirit on a positive note, like with writing the exam with candidates who were getting initially good marks, so that, it motivated you also, like, okay, I should also, go on the accelerator and improve also. So did you get that positive feeling as well?
Definitely, sir. Definitely. Like gradually looking at the improvement in the scores as well as the rank, and then consistently staying there was a very good motivating factor. I'm able to recollect what I have read. And if I keep it up like this, if I'm confident, then I will be able to do it even on the day of the exam when it actually would come. And sir, I consistently saw, like you said, sir, Pushkar was consistently rank 1 throughout the series, and he's rank 1 right now as well, sir. So it was quite like, I always used to look at the leaderboard, and there were consistently 20 people who used to stay there. It was fixed, sir.
Pushkar, Prachi, Ankit, everyone was there,
Yes, sir.
They were changing 1, 2, and Pushkar is 1 or 2 like that. So even Prachi was there. Aishwarya was there. So many candidates, you were there in the top 20. So happy that, all of you are actually, joining Central Institutes also. And, it's such a pleasure because, we are all colleagues, and I'm very sure that in another, say, 3 or 4 years, we'll be meeting in neurology conferences also. So as colleagues, and that's great. All right. So just tell us one more thing also. That is, during the course of your preparation, did you have feeling that, you were going behind? And if there was, how did you actually motivate yourself at that particular time?
Yes, sir. Sir, actually, when I started off seriously preparing for INI, that was in August, sir. I had good enough knowledge about general medicine per se. But sir, if you wish to compete for INI, you have to have an edge in the subject that you're competing for.
Yeah.
Sir, pediatric neurology was something that was very new to me.
Okay.
Like I hadn't done it well even during my PG days, and I found it a bit difficult, sir. But I thought that, okay, only 29 seats in INI. How am I going to make it in 29? I haven't even had enough time to read everything once. But then, sir, I personally thought that, okay, what is there to lose? Let's just keep on put your head down, whatever comes before your eyes, just keep on reading it, keep on reading it. At least 50% of it will be registered. Who knows, that 50% might be good enough, sir.
Yeah,
And
correct.
I kept solving MCQs as much as possible. Slowly, gradually, sir, I used to attempt MCQs once a week, sir, grand test. So the frequency of which I kept on increasing, twice a week, thrice a week. Then, sir, a few topic-based MCQs per day, sir. I gradually realized that, yes, I have started getting that instinct for getting MCQs correct, to narrow it down to 2 questions, even about things which I'm not very confident of, and then trying an educated guess. I'm getting at least 50% of them right. So,
Okay.
sir, one thing I believe is that, sir, if you are hardworking, you can compete with talent as well. So you
That's
have to
absolutely right. You're
keep
a
on
perfect
working
example
hard.
of that, because this is a very probably the most important message of the interview. Because see, at least some of you who are watching this interview, you might just get a feeling. See, Central Institute seats are for those who are rank one right from the first mock exam they write. But you should understand that there is a good number of candidates who actually work their way out. Initially they might be a bit behind, but then through hard work, it beats talent. So that is, he is a perfect example of that, and he has worked this way. And see how his graph has improved from his scores initially were not that impressive, but then by around October he understood, okay, now it's like in cricket, you feel the ball is coming to your bat. So you get that feeling, okay, it is coming to my bat, and finally it actually came, and you were able to perform well also. Now,
Yes, sir.
lastly, Vedant, see, your message to residents. Say the NEET PG counseling is now delayed, so the residents are going to join. So I am joining medicine residency right now. Can
Yes,
you
sir.
just tell them the approach to a medicine residency, and then how to, you said you were choosing specialty right from the word go. So how did
Yes, sir.
that instinct come? Okay, this is probably my specialty, because I still get many queries saying, sir, I am into third year, but I still have no clue what I should do for
Yes.
my super specialty. Yes, I want to do, but I have no clue. So how do you pace the residency? What is your suggestions for the joining residents?
Yes, sir. Sir, getting into, sir, first thing first, sir, I believe that cannot be a good super specialist unless you are a good physician, sir.
Yeah.
From the word go, our aim should be learning the annals of clinical medicine, sir. Without, like, from in
Absolutely
medicine, there
right.
is no
Absolutely.
uh, substitute to history taking, no substitute to examination, sir. Of course, sir, investigations will help, and these days investigations are the core of medicine. But, sir, we should always spend time bedside, sir.
Yeah.
It
And
doesn't
like,
matter if you have to stay for
just,
3 or
just interrupt there. I've done interviews like with the other toppers also, and everyone has said the same thing. Nobody has said like, see, when I joined medicine residency, you should prepare for neurology straight away or cardiology. The most important thing is to, be a good clinician, physician, because without that, you cannot be a super specialist. Because even if you're taking cardiology, you cannot just have a tunnel vision on the cardiovascular system. It is again linked to the neurology part as well, because you take cardioembolic strokes into account, which a cardiologist should have a basic idea, and a neurologist should also have an idea. So it is very important. Suppose it is a hypertensive bleed, it might be an endocrine cause of hypertension. So working up a young hypertension also should be known for a neurologist. So as he rightly said, the most important message for you residents is, first try to be a good physician, and then try to be a super specialist. Otherwise, you end up being a sub specialist. Okay.
sir, I always used to, like, when us friends used to talk about SS and what branches we want to go into. Sir, we always used to think about this one thing, that whatever we had learned for NEET PG, sir, they were textbook cases.
Correct.
And a patient before you will never be a textbook case. They will
Correct.
always have a multitude of sir, things that multitude of systemic involvement. So it's not that, okay, if you want to be a neurologist, you only have to read neurology thoroughly. Uh,
Correct.
Neurology, cardiology, endocrinology, nephrology, everything will have, there won't be any textbook cases when you are in the hospital, sir.
And see,
So,
how the INISS exam pattern has also changed. Previously for AIMS, it was just a neurology exam, okay, for AIMS. But now when INISS is there, they are testing your medicine knowledge also, which I think is the right way to do it. Because, you have got to have a good perspective. Yes, you should be very, very strong in neurology, but how's your medicine? How strong are your basics? That has to be tested. So that is also a right message.
yes.
So, first thing to all residents, he has conveyed, stick on to medicine, enjoy medicine, that is very important. It's not just about studying medicine. It's about enjoying medicine, seeing the cases, the diversity of cases of medicine. And then, what about the, dissertation, the life of case presentations? What about all those? Just go through that.
Sir, one more thing that I would like to say. In first year, there might be instances that when you are at a government center, you are way too overburdened, especially in the monsoon seasons and in the winter season when there are outbreaks of infectious diseases. So there might be time when we might not be able to even open one page of Harrison. So it's always good to have accounts such as UpToDate in our phone, sir.
Okay.
In today's times, everything is there in our phones.
Absolutely.
We just need to. So, sir, anytime you feel you have a doubt, it's always better to just search it in account like UpToDate and just check whatever is recently going on.
Yeah.
Many a time, sir, the crux and the important topics you might learn just there. And then when you are reading about that topic again, you might recollect a lot more than you might learn from just reading. So, sir, my personal opinion is that bedside learning is one of the best ways to learn in medicine.
Absolutely. Which is why, in doc tutorials also, in addition to the lectures, QBank, we have started this truly clinical session also based on clinical cases. So we have had a few discussions, neuro-ophthalmology, a case of autoimmune encephalitis. So we have had multiple such discussions, which we are again going to do in a full-fledged manner also from now on. So I think, what is your take on these truly clinical sessions?
Sir, a great initiation, sir. Like it's quite a all-round approach to a particular maybe symptomatology or a disease, sir. So at times, sir, just algorithms do not suffice. We also need sometimes visual memory is the best memory, sir. Visual inputs are always maybe at times the best form of memory. So, sir, if you see something, if you hear something, you might recollect it when you might see that kind of a case before you, sir. So I believe, sir, seeing and learning is a great form of learning, sir. So I believe it might benefit a lot of residents as well as those who are even have passed residency. Like it's quite a good initiation, sir.
What about the journal clubs and the presentations? How was that in?
Yes, sir. Sir, to be honest, in first year we didn't have much of presentations to do. We were busy with the ward work and getting the SCUT work done, sir.
Okay.
Right. Starting from second year, sir, we had super specialty rotations at our center, say neurology, cardiology, nephrology, and sir, a few branches where we had to present cases or topics on a daily basis. Like before the neurology consultants or before the cardiology consultants, we might be asked to give rounds of the cardiac ICU, CCU, by the cardiology consultant. Okay, what is in the ECG? Like, have you tried a V-scan by yourself? Do you know what is this view? What is this view? Have you read this chapter? So, sir, that is when we actually got into super specialty exposure, sir. Being a first year, we are more of horse with a tunnel vision, sir. Whatever our senior asks, we'll do it. We won't even think, okay, this was, or probably, sir, we won't even have the time to think, okay, this is for this reason. But, sir, the more you repeat, the more you remember and the more you can apply later on, sir. So second year is when actually you will realize that, okay, this subject is meant for me. The more time you spend in the wards of that super specialty subject, you might realize, okay, this is something I can spend the rest of my life is. Because, sir, once you get into super specialty, there is no turning back to anything else.
I think that is the best time to learn medicine. You cannot just relearn medicine once you take cardiology or neurology. Yes. So that time, just enjoy medicine. That is very important.
Enjoy medicine. Definitely, sir. And, sir, that is when we presented cases. We started presenting cases. We started presenting topics, if not cases. And sir, we used to attend journal clubs and mortality meets of, say, rheumatology departments, individual departments that used to hold it. So the residents or the fellows used to present cases. So we used to learn from them.
Okay.
So that was a very good
Okay.
experience, sir.
All right. All right. So he has given a very good overview of the residency as well. And now one last question for you. Like you've got a common merit list rank of 16 and an AIIMS
Yes.
merit list rank of 7, which means, you have performed very well in the interview. That is why
Yes.
you've climbed from 16 to 7. So,
Yes.
what about the interview? Like how was your body language for the interview and what actually worked out for you in the interview?
Well,
Because many students, have this inhibition to talk. An interview
yes.
is a different ball game. It's just not, selecting for options. You have,
Yes.
say, the professor and HOD of AIIMS or maybe
Yes,
the
Padma
associate
ma'am.
professor at the opposite end, and you've got to answer
Yes, sir.
questions. So just tell us.
Sir, first of all, I would like to mention that day when the top 30 list came out, and sir, you had organized a Google Meet that day.
Yeah.
So you had preconditioned us that the 10 minutes that you are going to have during that session is going to decide what the impression is going to be in the professor's mind.
Yeah.
You may be however good, but if you are not able to perform in those 10 minutes or if you fumble, then the professor at the other end is going to think that, okay, he's not good enough. So, sir, the first thing that I decided was that I won't be tensed. If I don't know it, I'm going to be humble and accept it that, sir, sorry, I do not know. Ma'am, sorry, I do not know. And move forward to the next question. Who knows, I might do well in the coming question. So, sir, the first thing I decided was that I'm not going to panic. I have everything to gain and nothing to lose. So, sir, I went
The
through.
questions, we have shared a lot of
Yes, sir.
questions. I have
Questions.
personally done mock interview sessions for many candidates over the past few years. So I have a good collection of questions of the interviews also. And I have shared that in the group also.
Yes, sir.
So, did you go through those interview questions?
Sir, on the basis of the questions that you shared, I decided I had a particular idea in my mind that okay, the questions are going to be like this only. So I don't need to read percentages and I don't need to read the very specific points. I am supposed to know a broad
An
idea about
overall
the
idea,
subject or the
an
topic.
approach.
Yes, sir. Yes, sir. Let's say, for example, I need to know how to describe the image of a neuroradio that is given before me. I need to know the clinical sign that might be given to me. I also need to be aware about the practical aspect of neurology, that it's not just theory anymore. They might ask me anything that is generally a topic of practical, say, sir, cranial nerves.
Yeah.
Like they might come up with a question of cranial nerves, sir. And maybe it's not about syndromes anymore. It's not about MCQs anymore. It is about, they might ask us how, and they might test on the basis of how much you have attended the wards and how much you know if a patient is given to you. So, sir, that is how I try to prepare myself, that it will just be like another MD final year Viva.
Yeah.
Like a practical exam Viva that a patient is given before you and how you will respond to it, sir.
Yeah.
So, sir, my interview was taken by Dr. Padma ma'am and Dr. Das, sir.
Okay.
So, sir, the questions, it started with management of warfarin induced ICH, sir.
Okay.
I gave a very structured response. I had it in my mind that anything that is given to me on basis of management, I have to start with a structured response. Like you start from the basics, the way the patient enters, and then just go as fast as you can, but in a clear way and without fumbling. Go slow, that's fine, but do not fumble. Do not let the professor think that, okay, he is not confident or he does not know. When I didn't know, sir, I said, sorry, ma'am, I do not know about this. And they immediately went on to the next question. And sir, the next half, I had a 10-minute interview, sir. Like the ICH question went on for 2 minutes, and the remaining 8 minutes were dedicated for the whole of MS, sir. For that matter, sir, demyelinating disorders. Even differentials were asked, and I had to describe the MRI, the axial and the sagittal section of the T2 flare that was given. And sir, gradually it went on to the McDonald criteria, gradually then symptoms of MS, the intermittent symptoms of MS, and then, sir, the treatment of MS, sir.
Even in the mock session also, like
Yes, sir.
that interview I had mentioned, two most favorite areas of Padma ma'am, one is stroke, another is demyelination. So even last year, madam was having a talk on pregnancy and multiple sclerosis in one of the conferences. So, you are bound to get those questions. And I think, for the viewers, the most important point is, see, from a common merit list rank 16 to a rank 7, he came, with a good structured response. As he rightly said, it's not the quantum of knowledge that matters in interview, how systematically and structurally with a neurophysician point of view, like, how you are going to approach the case. Like, the examiner should feel okay if he's entrusted with an actual case scenario of a warfarin induced ICH, he'll handle it well. And I think he handled it well, which is why, his rank actually went up, like almost 10 ranks up. And which probably got him the seat of his choice. Like, like you're going to probably AIIMS Delhi. So those 10 minutes actually decided your fate, correct? No?
Definitely,
so
definitely.
in the interview also, like those 10 minutes. So it's good that, you decided for yourself, okay, I'm not going to be tensed. So even last day, I had an interview with Shalini also. So Shalini told me, like, in the initial mock exam, which I conducted, mock interview sessions I conducted, initially she was a bit shy. But she said, like, once I attended the few questions, then, I got the flow of it. And that actually helped in the actual interview as well. All right. So, that is how, a few minutes can change your life. But the most important thing is that you had the presence of mind, you had the common sense. Also, okay, this is what the examiner expects out of me, because many candidates sometimes, because of the pressure, because, it's not, it's not very easy, like just saying that, at the other end, you have a prominent national figure. You've got to answer with confidence, but you've done that. And that's why, you are, a national topper also. So thank you so much, Vedant, for joining. You have had an exhaustive coverage. I think this interview will be very, very useful for those who are preparing for not just for the, the INISS or NEET tests, but again, a perspective of how, you evolve from a medicine resident to, your dream branch in a dream institute. Thank you so much, Vedant. And
thank you, sir.
Meet you also very soon in some neurology conferences. Because AIIMS PGI conducts a conference, if you know, there is a combined AIIMS PGI conference. So probably next time when I come there to for the conference, because last time it was virtual, and hopefully next time it is an actual conference, and let's all meet there. All right.
Okay. Sure, sir.
Thank you so much, Vedant.
Thank you, sir. Thank you, sir. It's been an honor, sir. Thank you.